welcome to the latest episode of Surgeons' Lives. I'm your host, John Monson. My guest today is Dr. Mark Orloff. He is a senior transplant surgeon in the University of Rochester Medical Center in upstate New York, where he has been on faculty for the last 34 years. Of course, he comes from a family of surgical royalty. His father was the late Marshal Orloff, who was chair of surgery in San Diego, and his sister, Susan, is also a liver transplant surgeon, making one of the rare combination of siblings who are liver transplanters. Mark was born in Germany, but spent most of his life in Southern California, where he was brought up in a beach community in the 60s. He is coming up to retirement now and has a lot to say about his career to date, living in the shadow of a legend, where liver transplant is going in the next 10 years or so. We were colleagues together for my time in Rochester, and so it was a great personal pleasure for me to carry out this interview. Don't forget to like and subscribe to the channel. Without further ado, let's go over and listen to Mark Orloff. I'm John Monson, and this is Surgeons' Lives. Mark, thank you so much for taking time out of your weekend to join this little podcast and talk about surgeons' lives, but more importantly, what I refer to as stuff that matters, which is a little bit beyond the normal CV and a glittering career and all that sort of stuff, some of the other aspects of life. So if you've had the opportunity to see any of the previous interviews, you'll know that I normally start by asking people to start by giving me a few background words, starting with the words I was born in.
Well, I did get a chance to see a few of your previous episodes, or parts of them. Not completely. I was born in Germany, in Stuttgart, Germany, when my father was in the military, and lived there briefly for 10 months, and then returned to Philadelphia, where my father was in training as a surgeon, and basically followed the family around from Philadelphia to Denver to finally land in Southern California in 1961, I believe. 1961, and outside of Los Angeles, and then we moved down to San Diego, which is really where I spent the formative years of my life. We grew up as one of six. I grew up as one of six siblings. We had 6 children within 9 years, so very busy family, and influenced a lot by sort of the milieu of my brothers and sisters. And my father was fairly absent, being an academic surgeon, and most of our childhood experiences were shaped by my mother and by my pack of siblings that I grew up with.
Yeah, I mean, and it goes without saying, and doesn't. It's one of those phrases where people say, "This person needs no introduction," and then proceeds to give an introduction. It goes without saying that your dad was, shall we say, something of a prominent figure in surgery, and within the years or that era of surgery. Which is a different era to now in terms of the way people live and behave and run their lives. He was, one always got the sense that he was more of an extreme individual than many, he's given lectures on the subject in his day on how he was, as you say, a 24/7 guy.
Yeah, yeah. I mean, and I think there was more of a culture of that in that era. And I think you and I, being somewhat contemporary, grew up seeing that. Definitely had its influences.
Hmm. Did it, how did it influence you?
You know, it's always hard. You examine your life prospectively and then retrospectively. I grew up in a very a wonderful place when we landed in San Diego, and we were in a beach community. We had surfing. Uh, what could be better? And it
Apart from Rochester, that is,
yeah, it's not, but Rochester's got its own
Yeah.
it got its own beauty. So I wouldn't mock it, and
No, no.
not go back to San Diego unless I could travel in time.
Yeah.
Uh,
Yes.
as we've seen our whole society sort of explode, it's really kind of interesting to examine those things. But I'll say that I went to school, went to public school, grew up in a little community, grew up among my siblings. We loved we loved the outdoors. We had great experiences. I really did not think that much about pursuing medicine. I just sort of just it was not a clear decision really at any point. I went to ended up going to college locally at UC San Diego, which was a very small school when I started, and it had probably doubled in size in the time I was there, and now it's an absolutely huge
Yeah. Yeah.
university.
Yeah.
But it was an interesting place to grow up, and was influenced by friends, by siblings. I studied biochemistry in college, and had thoughts of becoming pre-med, but was not really declared as a pre-med student. And
It's you know, I have three kids, and certainly my eldest, and none of them went into medicine, but my eldest, made a definitive or clear, intentional decision, I should say, not to do that because he saw that, I was pretty absent
sure,
during his earliest years, and I've chatted to him about this at length in recent years, and as he says, it's not a problem, but he just decided he didn't want to do that. So you were one of six, and I think your sister certainly followed the path.
yes, I have
How
two
did your
sisters.
sibs? How did your sibs pan out in that in terms of
Well,
deciding
so
to do it?
we're three boys, three girls. Almost just a little more, just a little over a year apart between the first four. My brother Bruce is a school teacher and exemplary surfer. My brother Eric is a public defender and an absolutely brilliant guy that still lives where we grew up. And then I have my two oldest sisters who are below the third boy are both surgeons. Susan, who's recently retired, and Lisa, who is a head and neck surgeon, and then my youngest sister is was a social worker. But getting back to the thought of becoming a surgeon, or just the thought of pursuing medicine, I fell into it. I was in a community of friends, many who did pursue medicine or biological sciences. And I went to medical school at UCLA. Really never really thought about becoming a surgeon. I always thought I would be an internist.
Yeah.
Mostly because you come into medicine, usually for most people, from a scientific background, usually a biology, chemistry, or some scientific discipline. And medical schools are run and taught by internists.
Yes.
So that's what you figure you're going to become.
Yeah.
And that's where the wonderment of medicine was always driven by the basic sciences that we lived and breathed when we were in, many of us, at least most of us, in undergraduate. So that's sort of where I was headed. And then, I started my clinical rotations and started off with pediatrics and didn't really have that great an experience with that. And then I did surgery in a county hospital, figuring that I wouldn't become a surgeon.
Yeah.
And I was really just amazed at how happy these people were. I mean, they loved what they did. They worked their asses off, and they loved it. And it just kind of rubbed off on you. Mentorship is really a very important thing. And I don't know subconsciously if there was something related to discovering, the things that my father did, my absent father did. There may have been subconsciously a drive to discover that world that was somewhat missing from me. Even though he was a very good father, it was largely absent. So that probably had something to do with it. If you were to really get into the weeds as a psychiatrist. But anyway, yeah. So that's really how things evolved.
So. Medical school, UCLA, residency.
Yeah, stayed at UCLA.
Yeah.
So another important point that I have to, if we're going into where one comes from.
Yeah.
My mother was a physician too. But she quit in the middle of her internal medicine residency to have 6 kids and her husband, and she ended up going back to a residency in her 50s as a radiologist when I was 15 years old.
Wow.
And she probably had a more profound influence on all the children than my father did.
Yeah,
She was a remarkable woman.
She must be one of very few people to do a residency, so late.
Yeah, it was. And, it was a struggle for her scientifically because, how many years passed? Could you imagine going back doing
well, especially in radiology, because when she would have graduated, there were no ultrasounds, no CT scans. It was a very minimum and chest X-ray.
Yeah, so she came in at the birth of ultrasound, at the birth of CT, and all this, and so it was, and it was, it's still really anchored in physics.
Yeah, sure.
So anyway, that's kind of an aside. But I grew up in Southern California, and I saw Southern California explode, and it was a great place to grow up at the time I grew up, and all of my siblings enjoyed it, and 3 of them are still right there in San Diego, and the other two are along the West Coast. So I'm out in Rochester.
So when you were a resident, the profession that you ultimately landed in was very embryonic. Um,
Yeah, you mean transplant?
yeah.
Oh, absolutely. As a matter of fact, it was nearly non-existent
Hmm.
when, I mean, it was existent. There were kidney transplants, but
Yes.
liver
Yeah.
transplantation, which is really where I ended up,
Yeah.
was in its it was still in its frontier experimental stage, and then cyclosporin
Yeah.
was introduced in 1979. And it really started to be employed clinically in the early 80s, and that's really when I entered into my residency. So when I entered into residency, I thought I was going to become a gastrointestinal surgeon
Right. Right. Yeah.
at UCLA. It was heavily influenced by William Longmire
Yeah.
and other luminaries at the time, and I thought I would be a general GI surgeon.
Yeah. What they like to call icons of surgery. I think the American College actually calls it icons of surgery or whatever. And so I was going to use the term fell into, but you ended up in transplantation. Um,
Yes.
and what was it that attracted you to that?
Well, it was kind of sideways. It was, I mean, in the early 70s, cardiac surgery was the big deal. That was the frontier. That was that was the thing that was cracked. And before that, it was some vascular surgery. And but what UCLA had a legacy for basically hepatobiliary surgery and gastrointestinal surgery, although there were other areas of surgery. I thought I would be a gastrointestinal hepatobiliary type surgeon. And then liver transplantation came on
Yeah.
the scene. And I also was I was heavily influenced. UCLA had a very diverse program. We were affiliated with two county hospitals, two VA hospitals, and then the major academic medical center at UCLA. So we had a very broad training.
Yeah. Yeah.
And, I was influenced largely by a group of surgeons at Wadsworth Hospital, and led by Ed Pissarro, who he was a phenomenal teacher. But a gentleman, a surgeon, an Australian surgeon by the name of Russ Williams, knew Les Blumgart, and Les Blumgart came to talk there when I was there, and I was intrigued at the possibility of pursuing a fellowship with him. So I did a 1-year fellowship with Les Blumgart after my 4th year of surgical residency, just because of training. I mean, it was a time I could do it. So I went off to the Hammersmith and then spent 6 months there as he departed the Hammersmith, and then joined him in Bern, Switzerland.
Bern. Yeah.
And that was
it's interesting. I think you must be maybe the 5th. I'd have to check the records, as they say. I think you might be the 5th person on this podcast who spent a year with Les Blumgart.
Well, I did look at some of your the others. I know Steve Stain followed me by a year or two. And,
so George Fielding.
Yeah.
And
David Linehan, of course.
David Linehan. And I'm just blanking on the other. Maybe Jeff Matthews. I'm not sure. I can't remember. But when you went to the Hammersmith, it would have been Irv Benjamin would have
exactly.
the sidebar, the
Yeah.
Milky Bar kid there, and he got left behind and took over. And then
Yes.
who was with you in Bern? Because was it just you?
I was his,
Oh, and that's who. Now that I just remember, the other one is Oscar Trainer.
yeah, right, right.
Yes,
And when I went to Bern, I was his first, what they call Oberarzt, which is
yes.
like a senior registrar. Um,
Sounds much more impressive, though.
yeah, well, sometimes you have to digress into the Germanic language.
Exactly. Yeah, yeah. I mean, in 90% of his personal characteristics or background, Les was completely unsuited to be in such an environment, except the 10%, which was that he was more of a Prussian martinet than most.
Well, Bern was fantastic for me. Um, you know, I, uh, I was able to punctuate my surgical training with a 2 year research experience after my second year, and came back for a couple of years, and then took a year off and went to to do this hepatobiliary fellowship, and which really is clinically, I mean, you work every day and you
Yeah,
take all, but it's not nearly as rigorous as being a surgical resident in the United States.
sure. Yeah,
And it was a tremendous experience for me. As you know, Les is an absolutely brilliant man.
yeah.
He's I think you described him in one of your with when you interviewed David as multifaceted,
Yeah,
and
that's for
that has a
sure.
lot of meanings.
Yeah.
He was not embraced by the culture there,
Hmm.
but he embraced me.
Yeah. And he
And what
seemed
was
to do that with his overseas fellows, and I think possibly because he was not embraced by the local community. The people who worked with him, you and David and whatever, they were his, if you like, his backup, his go-to people. It was you and him against the world type of thing.
Yes, and exactly. But what was even more curious was the Swiss surgeons. I mean, it was a very different
Yeah,
system
it is. Yeah,
there, and I think Les was much more familiar. Even though the British system's much different than the American system, he trusted the American approach to surgical education more. And what was really nice about that place was despite some of the somewhat somewhat acrimonious nature of many of the Swiss trainees and junior faculty, they treated me just wonderfully. I mean, they could compartmentalize their feelings fairly well.
yeah,
And
yeah.
it was an amazingly rich experience. I had developed incredible friendships there, and I learned a different approach to medicine. So
And so you've been in Rochester now for how many decades?
over three.
Over three. So
I'm fourth. I mean, I've been here for almost 34 years.
so tell us the story of how you ended up there.
Well, uh, I was a very junior surgeon at UCLA. I'd been trained by Ron Busatil, who was just lighting the world on fire in clinical transplantation, and was also influenced by a number of. I was doing some research at a competing uh, transplant program over at Cedars-Sinai, which was affiliated with UCLA, but was working in a lab there. And I was just trying to find my direction, as a young academic surgeon.
Yeah.
And, there aren't that many venues to practice transplant. So you don't just write your ticket in a field that's so small as transplant, and the unfortunate thing for many trainees in transplant that may be remarkably talented, they gear up to do liver transplantation, but then they can't find a job doing it.
Yeah, exactly. Yeah.
It's a real problem.
Yeah.
I was fortunate enough to be recruited by Seymour Schwartz, who was starting a liver transplant program, a fledgling liver transplant program, and found myself as a very junior surgeon out here, joining another junior surgeon under the direction of a kidney transplant surgeon named Jim Cirilli. And the program had a lot of, growing
bumps in the road.
A lot of bumps in the road.
They all do.
Road, and as many of us do, we also have personal bumps in the road along the way, a divorce and that sort of thing. But I really just stuck to it and honed my craft and gained tremendous experience by, in part by working with many surgeons that rotated through, that came and left.
Yeah.
Because one thing about transplantation, it does attract a certain personality, and I see. And
I'm not sure what to say about that. I mean, I think I was just wondering at one point how many siblings have become liver transplant surgeons.
Well, probably not. I mean, my sister and I are the two that come to mind. I think there's some husband and wife teams.
Okay.
Asher and John Roberts and Liz Pomfret and Jim Pompicelli. But I don't think many siblings.
Not many.
My sister took another path too. My sister, who I think is a more distinguished transplant surgeon than myself, far more distinguished, is she started off in internal medicine at UC San Francisco.
Yes.
And she trained in the midst of the AIDS epidemic.
I'm hopeful that she would say exactly the same about you, that you are a more distinguished transplant surgeon than her. But let me ask you a couple of things about that journey. So there are times where being the offspring of, I don't know, I use the overused word, but the offspring of a legendary figure is a good thing, and there are times when it's a bad thing.
Exactly.
It's very difficult to live up to, and I've known several people like this, and it's not that easy to deal with. But there are times when it opens doors. It just does. I mean, the name will open a door, and I don't know, but perhaps that first job in Rochester, Cy would have been a contemporary of your dad and all of that sort of stuff. There would have been name recognition, shall we say, that gets you the initial phone call, etc. On balance, for you, did you find it a help or a hindrance being with carrying the name Orloff around for your career?
Well, undoubtedly, it does a little bit of both.
Yeah.
It probably opened doors.
Yeah.
Undoubtedly. It gave me exposure. It gave me a pass on possibly
Yeah.
certain things. There's naturally enemies that
Yes.
will sometimes take it out on you. And but more importantly, I think it really comes down to how one deals
Yeah.
with living under the living under the in the shadow, under the umbrella, and
Yeah.
that probably and you reevaluate that through different parts in your life.
Yeah, because
Uh,
you have as you say, you have the friends and enemies. That's easy, some good, some bad. But again, I think as we use the term multifaceted for Les. I mean, your dad was pretty multifaceted as well, if we want to use that description. Did you ever struggle, and just internally with the concept of living up to the reputation?
you know, that's an interesting question because I do think about these things. I don't really think I've tried to define myself in a
Yeah, yeah, yeah,
different way. You know, quite truthfully, and that has been less of a burden for me.
yeah.
I haven't tried to in any way compete or
Yes,
pursue things in that way. And maybe that comes more from approaching life a little bit more like my mother than my father uh, did. But that's what I can say about it. I just try to be me and try to look at medicine. I mean, medicine's a great field if you're interested in people and
yeah.
interested in people's lives and interested in people's stories and where they come from, and just to kind of just talk to people.
No,
And
I agree with that wholeheartedly. I spend a lot of time telling residents that and fellows that you need to know your patient because more often than you would like, you're not going to actually be able to fix them. And if you don't have a relationship with the patient and understand who they are and what they are and where they come from, you're going to have a much more difficult time dealing with the fact that, by the way, this famous surgeon can't fix me. It's the operation is really a small piece of the relationship.
well, yeah, and a small piece of healthcare.
Yeah,
I
yeah,
mean, and unfortunately, we have this perception when we're entering into it that that's the focus because
yeah,
that's the challenge. But it really is holding the hands and healing in assisting people to cope with their ailments. That's what we
exactly,
do.
exactly.
Um,
So, so you've been in Rochester, as you say, you're into your fourth decade, and uh, you have worked under the guidance, tutelage, mentorship, and whatever you want to call it, of multiple chairs
yes.
over that time frame. And I'm certainly not going to ask you who was the best chair. But Cy, as you know, had his office just around the corner from me, and we used to talk a lot because he was kind of a hibernophile and etc. And he was a wonderful man, as you know. But he did say to me one day in the confines of his office that he did not think that he was a very good chairman. He felt he functioned better doing other things. And as you know, he was president of anything that was available to be president of, outside of Rochester. And I said to him one day that I thought he had done something really quite unique. He'd reached the position that was normally reserved for people who were dead. And he said to me, "What do you mean?" And I said, "Well, normally people have to die before people forget all of their weaknesses and just focus on their strengths and their wonderful achievements. Whereas Cy, in his latter years, was an incredible person. Everybody viewed him with affection and love and respect, etc. And I always thought that, even though he was very interested in what was going on around him, he achieved that thing that few ex-chairs do, which is the ability to remain in place without being a malign influence.
Yeah.
I always gave him great credit for that.
Well, I mean, Cy, I call him Cy for was an amazingly loyal person. He was the best cheerleader that one could ever have. Somebody that was very supportive. I spent a lot of time in his office, as you did, not really to discuss any of my problems. I wasn't going to him I just went
just to talk to him.
Just to talk to him and enjoy his intellect and
exactly.
his take on things. And I just had so many wonderful moments just spending time there, talking to him. And he was like, you'll never meet a person like him.
No, we've referred to multifaceted people. I mean, he defines that, as that famous story that everyone knows about his wife saying to him, you're very boring, Cy, you need a hobby. And him saying, well, you have to find me a hobby. I don't have time. And her coming back with the secondhand book. And I remember saying to him, you're such a loser, Cy. I said, most of us have you have a hobby, your wife gives you a book, and the next thing you're advising Congress and writing books and helping the Smithsonian, give someone else a chance. An extraordinary guy,
Yeah. Indefatigable.
Yeah, exactly.
He burned without without moving very fast.
Exactly. And incredibly, and he was very proud of the fact that all the years in Rochester, he never bought an overcoat.
He didn't spend, I don't think he spent a lot of time out in the woods in Rochester.
No, he wasn't an outdoors guy. That's for sure. So, so you're coming, shall we say, to the autumn of your career. We'll use the autumn.
I would say it's John, I'm retiring in a couple months.
Yeah. So, but nonetheless, you may become like Cy, you could become a world expert in something. But so if I was the young Mark Orloff walking into you and saying, Dr. Orloff, this is apparently going to be my office. You're leaving and retiring, and God bless you. What advice would you give me as I embark upon a career in the 21st century? You and I grew up as my good friend in Dublin says to me, a previous century.
Exactly.
And in a different era of medical care and everything. What's your take-home message to that young surgeon?
Well, I've got a lot of experience, but I'm not sure I'm that wise, if you know what I mean.
Yeah.
Medicine has changed dramatically in our lifetime, and you have the ability to examine a much more impactful healthcare system from your time in the UK to your time, even though there's plenty of faults with that system, to our highly productive model of procedure-oriented medicine, but very fractured care.
Yeah.
currently experiencing. So, I mean, medicine it's, I think we're in for a big challenge. And I guess the best advice I have is really, pay attention to your patients, pay attention to their needs. The technologies that we're using in medicine are just so much different than what you and I learned.
Yeah.
The ability to treat disease, but not the ability to care for. The ability to treat disease has changed. The ability to care for people hasn't.
Far. It's got
And
worse. It's got worse, I
it's
think.
gotten much worse,
Yeah. Yeah.
much worse.
Yeah.
It's gotten more complicated, more fractured. I mean, I practice in a wonderful area of multidisciplinary medicine where it's very team-based,
Yeah. Yeah.
very integrated, and it functions pretty well for our little unique area. But if for people getting outside of that bubble, which is most of medicine, it's just it's broken.
So I
And
tell,
go ahead.
I'm sorry, I tell young colorectal surgeons that, 10 or 20 years from now, they're not going to be operating on colorectal cancer because the molecular medicines are already impacting on, with appropriate targets, or already meaning that we're not operating on rectal cancer half of the time. It's only inevitable that that's going to go to colon cancer. So that's a position where the operation becomes irrelevant, increasingly irrelevant, because the modern molecular medicine is able to cure the underlying condition, namely the cancer. That doesn't really sit that well at the moment with transplant. So what do you think is going to be the next big thing in transplantation in 25 years?
Well, let's. I've always thought that transplant in that evolutionary tree was always just this side thing. It was a dead end.
Yeah.
I mean, it is. It's a transition. It's really a transition to something else, and molecular medicine and other diagnostic approaches, but mostly therapeutic approaches,
Yeah.
probably going to, at some point, and I don't know when that is, eliminate it. We've been knocking on the door of we've been talking about xenografts, but xenografts have been around for
Yes.
over 100 years. And I'm not sure that we keep getting closer in some ways, but I'm not sure we're really going to be developing colonies of pigs to replace organs with. I don't know how sustainable that is, and I don't know. I really think it's all is, as someone said, it's just around the corner, and it's where it's always going to be.
Yeah. Well, it's probably just around the corner because we've been driving around a lighthouse for decades.
Exactly.
It's constantly around. So do you think we'll find a medication, a molecular target to stop people destroying their liver with alcohol?
Well,
You
alcohol.
won't stop people drinking, but you might be able to protect the liver.
But the curious thing is that alcohol doesn't destroy most people's liver. I mean, it's about 30% of the population that have a sensitivity to the inflammatory changes of alcohol. And I think and there's probably some crossover there with the metabolic syndrome and MASH and those sorts of diseases, which are becoming they're becoming better understood, certainly not completely understood, but I do think there will be movement along those lines. And as far as autoimmune disease, which is another big component, I think there's a lot of mysteries there that will be unlocked, as we understand, immunotherapy and
Yeah.
immunology better.
Yeah.
So I do think ultimately it's not going to be in my lifetime, but we will. I think hopefully we will get to a place where organ replacement's not necessary.
Well, yeah. I mean, it may not be in your lifetime, but I mean, the pace of impact of molecular medicine is accelerating. I mean, it's
Yes.
rapidly. I mean, basically, none of this existed at the turn of the century, and it's gone to where we are in the last 20, 25 years. So, I have a strong suspicion there'll be many fewer colons and rectums taken out in 25 years, but also many fewer livers transplanted.
Well, I mean, as you was uh, interested when I looked at your panel. Norm Williams, you interviewed Norm Williams. Norm Williams crossed paths with me at the Wadsworth, just like Les Blumgart did
Yeah,
when he was a younger surgeon. And the same thing goes for. Remember how many stomachs they ripped out in the 50s?
yeah, sure,
That
sure.
was the whole
Yeah,
basis of surgical training.
yeah, no, for sure. Yeah, for sure.
And these diseases come and go.
Yeah, I mean that's there were people that based their David Johnson, his mentor and boss, based his initial career on highly selective vagal.
Yeah, and how many highly selectives have you
Yeah. Of
seen done in
course,
your
that suffered from being an operation that only three people in the world seem to be able to do. One in America, one in the UK, and one in Denmark. So when the and I shouldn't be asking for people because people would may not know that this is happening. This interview is happening on a Saturday morning, but when the lights go out on Friday night, what does Mark Orloff do to get away from surgery?
Well, I've been transitioning in my, I was just doing crazy hours 10 years ago,
Yeah.
surgery, and we've fortified our surgical division, and I've had a much easier life in the last 10 years than I did in the previous 20 um, of my career. But I do a lot of stuff. I mean, I spent a lot of time with my youngest kids.
Hmm.
I have one that's about to go to college next year. He's a senior in high school. I, we ski a lot together. We fish together. Um, it's and so I do a lot of fly fishing. Do a lot of
Are
skiing.
you? Does retirement frighten you?
No, it doesn't. It doesn't. I've been trained. I mean, my work used to define me.
Yeah.
I don't think it does anymore.
Yeah.
I have a lot of interests. I have four kids. They're all happy, and spend. Get to. I don't get to. I have two twins that live in Colorado,
Yeah.
and my youngest and I just went skiing with them for a few days
Huh?
a couple weeks ago. Spend more time with them. I have a lot of great friends. I grew up in with a lot of really really nice people that are still very active, and I just want to spend
Hmm.
time with
So,
them.
so that more than most people that the memory of people who work in institutions is fleeting and transient.
Yes,
And 6 months after you've retired, people will be checking whether two Fs or one in Orloff. So if they if you make it onto the wall of the hallowed hallways of the Department of Surgery in Rochester, and 5 years from now, when somebody says, "Who was that guy? What did he do?" How would you like to be remembered?
I think probably in academic medicine. I mean, I've had I had a very brief research career. I mean, I struggled in my research. I had some NIH funding early on, and that
Yeah,
and that wasn't able to assemble the right pieces because it's all network
sure.
anyway.
Yeah,
You need and this was at the time, this was not a very good institution to do transplant immunology.
sure, sure.
And
Yeah.
then I had I worked with a brilliant liver immunologist for a while, which was very, we had some good publications, but the research is no longer part of me. Patient care is very good. The patient stories, what I've done for patients, I think is good. But probably your biggest legacy are the people that you directly teach, that you mentored, that briefly had time to work with you, that you taught them a few moves in the operating room. You taught them
Sure.
a few ways to deal with patients, to ask questions, and your legacy really. I mean, it's a very primary process. You touch a few people in your life
Yeah,
with your actions and with your character and with your thoughts, and they go on and they sometimes repeat what you've said.
sure.
you
Yeah.
know I think that's really all it comes down to, John.
I have
I'm
a,
not
a
I don't think.
fellow, I have a fellow who used to say to me when operating, he'd say, that's a CAM. And I'd say, what? I'd say, that's a critical attending maneuver there. So,
I mean, I just don't think you can take oneself too seriously.
no, exactly.
You know
Yeah, I
that.
mean, it's, George Fielding, amongst many other people, said in his interview, he would just like to be remembered as a good guy.
Yeah, I think that's really that's all I want.
Yeah, exactly. So, okay, here's some much more deep and inquiring and profound questions. Okay,
Uh-oh.
and you don't get a lot of time to answer these. First of all, baseball or football?
Uh, 20 years ago, it would have been baseball. Now it's probably football.
Okay, what happens when we die?
We just go bye bye.
Okay,
We just go into the earth, and our molecules our molecules probably live for some of the
contribute.
elements,
Yeah.
but we just get recycled, John.
Okay,
Sorry to say.
okay. Um, have you ever asked anyone for an autograph?
Yes, I have.
Who?
Sandy Koufax.
Ah, did he give it to you?
Yeah, he was doing a book signing when he enlisted
Uh-huh.
66. So yeah, I took my baseball mitt there and got Sandy Koufax, got a ball autograph by him. And
Excellent. So
I don't know,
who?
most people these days probably don't know who Sandy
Yeah,
Koufax is,
true.
but
I can put it. If I remember, I can put a link on the thing.
he was a
Yeah.
remarkable person. He went out on top.
Yes.
He
Very
went out
few.
on top.
I mind you, years and years ago, I was interviewing a guy in England who was a world famous cricketer,
Uh-huh.
and it had been accused. He had been accused of hanging around too long.
Yeah.
And I asked him about it, and he said, well, he said, firstly, that's none of their business. He said, he said, secondly, you're retired a hell of a long time. He said, and thirdly, what? Yeah, I didn't do anyone harm playing past my best. He said, he said, leave me alone.
Just the people that bet on him.
Exactly. So, Friday night, you're having a dinner party at home and you have two spare seats, and you can invite any two people from history to come and fill those two seats. Who are the two people that you would like to invite?
Well, I'm gonna cheat on this one.
Uh-huh.
Um, because your life is kind of a tape loop that keeps going around and around, and you keep reprocessing the same experiences, but with a different as you go on in time, as you evolve, you get different perspectives. I would probably want to have my mother and father back to ask them perspectives on things that I am dealing with now that I'm, at a later stage in life, and just share some experiences, but more importantly, share some perspectives and knowledge how you negotiated those things, because those are people that you know so
Yeah,
well.
yeah, yeah. And it's interesting, there's the way the inflection we use in the words we speak make a lot of difference. And what of course you're doing is proposing to sit down and say to them, "What were you thinking?" Um,
Yeah.
and there's multiple ways of saying, "What were you thinking?" You know. Um, and who amongst the world today do you admire? A public figure, of course.
Well, I probably, because I'm very distressed by our polarized society, I probably admire some, journalists that are trying to, break through and, break through to the truth, you
I,
know.
I was thinking a week or so ago that journalism in the era of Bob Woodward and Carl Bernstein was tough. It's always tough, trying to get information from people who don't want to give it to you. But it's a different form of toughness now. I think it has a strong risk of being dangerous now. And I take my hat off to these people that are persistent and don't give up.
Well, I mean, there's some absolutely courageous people out there,
Yeah, yeah,
doing the necessary work. So
yeah,
those are the people that I'm paying attention to now. You know.
yeah. So, Mark, I'm delighted you spent the time with me today, and I really appreciate it. And I think a lot of people will enjoy listening to um, the imminently retiring old guy.
Well, I think we're similar in age.
Exactly. Yeah.
You're I just don't have a big administrative gig.
Yeah.
Uh, and I do want to quit while I can still operate.
Yes, exactly.
You want to
Yeah,
live.
and I've asked a few people in the 50 or so interviews that I've done, how did you decide and how will you decide? And it's interesting how, and you definitely you want to stop before somebody taps you on the shoulder who you
Oh,
don't know, that's so it's been one of the joys of my time in Rochester was having you as a friend and colleague. And it's one of the things I miss about Rochester. But as we finish, can you just finish by uh, telling us what do you recall as the best piece of advice you were ever given?
oh, geez. The best. Um, you know, professional advice uh, probably was. I mean, you have to be a truthful person, but Ed Pissarro told me that you do have appearances matter. I mean, he was just a straightforward, blunt guy, very understanding person. But he said you do have to pay attention to how you are perceived uh,
Yeah, yeah,
by others. And that was not meant in a, in any sort of a devious way, but you really do have to be conscious of of your impact
Yeah.
on other people.
And I guess the phrase is perception is reality to some people,
Yeah,
Yeah.
that would be it.
Well, thank you so much, Mark. It's been a great pleasure. And
Well,
this will come out sometime in the next few weeks. I shall let you know.
yeah, well, I do want to end this, in a similar, bit of thanks to you, in that I've always marveled at sort of your ability to see things in a bigger perspective, to grasp concepts and to translate them, into thoughts. I mean, I did learn a lot from you, kind of in comments and approaches and just analysis. And I enjoyed our time together.
Thank you so much, Mark.